Hello everyone and welcome back. The reason I'm doing this series of videos is to help everybody with chronic diseases and especially diabetes and those healthcare professionals that care for them to understand what's happening with the economy, with the finances, and how to survive the coming few years. Things are more expensive and it seems like things are more difficult and the prices are going up every day. We need to be able to survive what is happening right now and make it through the next few years with least inconvenience. And that's what I'm trying to do, because the reason I'm doing this is because I have noticed in the past, whenever we go through financial crisis in the United States and in the world, that one of the things that people tend to sacrifice, unfortunately, is their health care. And that can have very bad consequences on the long run, especially with something like diabetes, where a few years of uncontrolled diabetes or also hypertension and other chronic conditions can lead to very bad long-term consequences on health. Things are expensive, things are difficult. It's difficult to financially manage things right now. I totally understand that, and that's why I want to help. My name is Sharif Yacoub. I am an endocrinologist, a specialist in diabetes and other endocrine diseases or hormonal disorders. And I'm board certified in endocrinology. And I am also very aware of the finances and economic factors that are going on right now. I have studied them in depth. And if you want to hear more about the reasons for what's going on right now, I can make a separate video. But this series is really targeted to help you understand how to manage and navigate these difficult economic times. For healthcare providers, I want to explain that a lot of people are struggling and are suffering financially. They might not see it, they might not explain it to you, but they are definitely struggling. And a lot of people are having to go without their medications because medications are very expensive. A lot of times people avoid healthcare, expensive surgeries, or even office visits because they can't afford their healthcare. A lot of times people have to choose between their food and between their medications or healthcare. It's a very serious situation, and I hope by helping you to understand what's happening that you would be able to help patients a bit more, that you would gain some understanding and compassion to them, but also for you as a healthcare professional, it makes a big difference when you understand these things so that you can also survive these hard financial and economic times and see things from your patient's perspective and see what is happening, as well as for your own financial benefit to be able to understand these things. Now, the way that I'm going to proceed through this series of videos is going to really depend on what kind of insurance the person has. There are ways to handle everything, ways to handle situations where you don't have any insurance or any healthcare coverage whatsoever, and situations where you have full coverage but it's still having a hard time making ends meet. So I will divide the videos by healthcare coverage basically, and the next video I'm going to do is going to be about what to do in cases of absent healthcare coverage. There is no healthcare coverage whatsoever, no insurance whatsoever. What to do in those cases. Okay, let us meet and discuss these things in the next video, and until then, have a great day.